Hello, everyone, and welcome to Biohackers Lab. I'm your host, Gary Cohen, and on today's episode, I have Dr. Ana Rosa. Dr. Ana Rosa is an MD and PhD who is an American and Brazilian board-certified radiologist who has been in practice for over 25 years and has published both research papers in medical journals and contributed to imaging textbooks. Dr. Rosa is going to share with us today her imaging knowledge of visceral fat, why it is important to look at it as a biomarker, and her personal story of how to reduce visceral fat. Ana, thanks so much for coming on for an episode for today.
Thank you so much for inviting me. I'm looking excited for our conversation and sharing the images and sharing knowledge and sharing life.
Yeah, I think that is exciting today because we're going to have a little bit of show and tell on this one. So for anyone who's listening to the podcast on audio, I'm going to try out my best to explain the images over audio. But for people watching YouTube, you're going to see my screen share, and we're going to actually see these MRI scans of this fat that we're talking about today, which is called visceral fat. So, Anna, if you wouldn't mind, my first question for you is just going to be really nice and easy of like, what is visceral fat? If you had to explain visceral fat to someone who has no idea what this thing is.
So visceral fat is the fat that we have inside our abdomen, inside our abdominal cavity. Visceral fat is surrounding all the organs we have in our belly, which are the liver, the pancreas, the spleen, the bowel. So visceral fat is a silent enemy that we have inside of our belly and surrounds all our organs. And we can see it very well with MRI. And visceral fat is important because it produces inflammatory substances all day, 24/7, which are called cytokines. And these inflammatory substances are one of the root major causes for chronic disease, such as prediabetes, diabetes type 2, diabetes type 3, which is dementia, and, cardiovascular problems, memory problems, and all these kind of diseases, cancer. There are at least 13 types of cancer that are strictly correlated with visceral fat, that were not strictly correlated, but that they were shown to be related to visceral fat as well. And we also have a different kind of inflammatory fat that is similar in the properties of visceral fat, that is located in our chest, in our thorax, surrounding our heart. And also we can have fat in our liver, in our pancreas, and in our muscles.
Okay, so yeah, this is a different kind of fat because it's inside our body and it's not the stuff that everyone wants to get rid of on the outside, but we should be focusing on what's actually happening inside us too. And so knowing that this is the fat that sits around our important organs inside our body, is there a normal level of fat that we should have around our organs in our body before we get started when we talk about excess visceral fat too?
So there is some fat that is localized it's called retroperitoneum in your abdomen. And it's the fat that surrounds some of your vessels like the aorta and the vena cava and also your pancreas, a little bit around the kidneys. And this could be a normal amount of fat. But when it comes to visceral fat, technically, the ideal would for us, each one of us, to have zero. But it's the ideal. And unfortunately, as a radiologist, what I see day in and day out, and I have seen through my almost 30 years of practicing as a radiologist, is that 95 or more % of people in our lifetime right now have extremely severe amounts of visceral fat. So that's kind of like alarming that almost all of us have not a little, but a lot of visceral fat in our bodies. And it has been like I said, our silent enemy. No one has ever talked about it. No one has ever described it in the radiology reports. And we talk about everything that comes from visceral fat, but we never really addressed the elephant in the room, which is the visceral fat.
Okay, so yeah, the takeaway for me there is if you happen to have a scan and the radiologist does report on your visceral fat, you don't want to be hearing that you've got lots of it, because how would a radiologist like yourself then tell someone how much visceral fat they have? Is it a number? Is it how is it described to a patient?
So there were studies showing that the quantity, the number like 10%, 20%, 50% is not as impactful in the client or the patient as when you see it, like when you see all the fat surrounding your organs. So it's for me, and it hasn't been described before. It's very new. I believe I am one of the few radiologists that might be describing visceral fat in the whole world. And I've learned that with Dr. Sean O'Mara. Thank you so much to my friend and mentor who is saving my life together with my own effort. And yes, so I have been describing as mild, moderate, and severe, but again, or advanced. But again, unfortunately, even for me, like I said, 95 to 99% of the people in the world are gonna have like extremely important amounts of visceral fat, including thin people, including people that believe that they are skinny and they don't have any problems with visceral fat. They have something called invisible obesity. So it's the visceral fat that is inside your abdomen and you look like as if you are healthy, but you are not. And these individuals are the TOFI ones, thin outside, fat inside. And you're only going to know that if you have an MRI or if you have a scan from your abdomen, either CT or MRI that you had done in the past, and you could go there and take a look on your images and unfortunately sit down, because you might just get really surprised that you are at high risk for a cardiac attack or a stroke or diabetes or all these horrible things that are correlated to visceral fat.
Okay. Yeah, because I do want to get into that, because that's what I find so interesting, as you said, where visually you think you're healthy on the outside, but because you don't have the images to see what's happening inside, you have no clue. And as you said, there's people who could have a lot of this visceral fat inside, but they think they're healthy on the outside. And we've got some good ones with the BMI images that we'll get into on your one there. But actually, just coming back to what you said from a scans point of view, because I know that's what people are going to ask is, does it have to be an MRI scan or a CT scan in order to see this?
So if you had done, we call it cross-sectional imaging study. If you had done a CT or an MRI in the past, recent past, or even if it's longer than a year, just for your own curiosity, either the CT or the MRI, both of them you would be able to see your visceral fat. If you have not done any of either a CT or an MRI, I would say you would prefer the MRI, because the MRI doesn't have ionizing radiation, right? So you could repeat it more often in your follow-throughs. Would you get a provider order for an MRI? Probably not. Would you get the insurance company to authorize it? Probably not. But there are like increasing doctors that work with metabolic health or functional health or integrative medicine, or doctors like Sean O'Mara that see patients all over the world that would have a program for you. They would order your MRI and you could do it out of pocket, and you could negotiate a better price, because it does not need to have any intravenous contrast. It's a simple MRI of your abdomen, upper abdomen, without intravenous contrast. And that would be the best exam that I would say for you to see visceral fat without ionizing radiation, without risks. Of course, there are some people who cannot have MRIs, but I don't even need to say this here, because MRI safety in each clinic would catch you. Like if you have a pacemaker, if you have some kind of metal implants, if you have that are not MRI compatible, then you're not gonna be able to do the exam. But the clinic will be able to triage you better than me just talking here.
Yeah, perfect. And the other one will be a DEXA scan. would a DEXA scan be able to tell me how much visceral fat I have? Because people go for DEXA scans for body fat percentage. So does body fat,
Yes.
so that would sort of tie into, sorry, the other question, which would be, so DEXA scans and then body fat, does body fat percentage equal visceral fat?
Body fat percentage does not equal visceral fat. Body fat percentage evaluates all the fat you have in your body, right? So it could be the visceral fat, the subcutaneous, deep, and superficial fat, the fat surrounding your heart, might even be the fat in your muscles. So the body fat percentage is telling you all the fat you have in your body. There is a DEXA scan that gives you some visceral fat analysis, and that would be, I would say, if you are not able to get an MRI, that would be a study for you to start with, because you can always monitor yourself. And if you are a very A plus person, I believe the number on the DEXA scan will be good enough to give you stimulus and stamina to work on getting better. However, when you do the MRI, you are engaging your visual senses, you are engaging your sensory brain too, right? So your feelings and your emotions will help you take action in a way more productive way. So the MRI really, when you look and you see, I did my, if you look, when we're going to show my scans. So I did a DEXA scan and I had 44% of visceral fat. Oh my God. Visceral fat, 44% of body fat. So I am half fat, right? Walking around the world. And when I did my MRI, I will tell you, and we're going to see whoever is going to be able to see the images. It definitely had a major impact on me. My MRI seeing how much visceral fat I had and how little muscular mass I had and how much fat I had in my muscles. The MRI definitely, the visual definitely, I couldn't, when you see it, you can't forget it. You go to bed and you're like, oh man, I can't think about that MRI image, and you're not going to think about the 44% number.
Okay, so a picture speaks 1,000 words, as they say.
Yes.
And it's more powerful. Okay. Yeah, I'm looking forward. We will get into that screen share in a little bit there. Before we just do that, one last one would be, are there any other proxies that someone could use to determine if they might have a visceral fat problem? So if they didn't happen to go for a scan, could they sort of, I don't know, hip to waist ratio or some other metric that they would say, hey, look, I'm a little bit too big for myself, so there's a chance that I could have visceral fat. Are there any proxies out there, or not really? The best way is just imaging.
The gold standard would be the imaging, right? The MRI. A second one, again, like we talked, for you to have a general idea, would be the DEXA scan. As a radiologist, I say that if even with an X-ray, I am able to see that the person has a lot of fat because fat has a different density, but that wouldn't have any impact on you as a client or as a patient, right? I would say that the shape of your abdomen, if it's more protuberant, if instead of being when you lay down, if your abdomen goes more flat, it's probably that you have less visceral fat and more subcutaneous fat. When you lay down and your belly just comes up and you can see the belly, right? That's probably the visceral fat because it's a harder fat as well. So Sean talks about this, you could lay down on the floor and you could measure from the floor up to your belly button, and you could monitor that. Of course, it's not the best metrics, but it's better than nothing, right? And there are many metrics that he talks in his videos too, like facial characteristics, you can look at pictures from when you were healthier, and you could see the shape of your nose. You could see your nose is thinner and it gets wider and it gets redder, reddish when you get more visceral fat because it's inflammation. So inflammation is swelling, which is getting bigger, and redness, right? So when you have your facial characteristics that you have more redness, your nose is wider than how it used to be. You are not really able to see your palpable pulses very much. The shape of your abdomen, or like, yeah. So these were the things that I would say that are more helpful as well.
Okay. And actually, the one you mentioned there was the soft and the hard fat. That's something I remember years ago too, is that someone could have like a soft belly fat or they could have a hard belly fat. And if it's hard, it tends to be coming from the inside out. So it's the visceral fat versus the
Yes.
outside fat, which is the subcutaneous stuff.
Yes, like me, in my own experience, when I had way more visceral fat when I started, I would lay down and my belly would look like as almost as if I was pregnant, right? The pregnant belly, like going up and hard. Now that I lost a lot of visceral fat, I still have visceral fat. And again, it's a journey of healing and getting better. But now that I lay down, my belly is way more flat. And I know that it's much more the subcutaneous fat than the visceral fat inside the abdomen. And it's also important to look at your subcutaneous fat in the MRI because there are two types of subcutaneous fat. There is the superficial subcutaneous fat that is just beneath your skin and it's protective. So you really don't want to get rid of that. You don't want to do like surgery to get rid of that because it produces substances like adiponectin that have cardiovascular protection effects. And then you have the deep subcutaneous fat that we can see as radiologists in the MRI. And this deep subcutaneous fat is as horrible as the visceral fat in your abdomen because it also produces the same inflammatory substances. So there is the visceral fat, the fat surrounding your heart and your vessels in your chest, the aorta and the aorta, the fat in your muscles, and the subcutaneous fat, the deep one, that are not good for your body, for our bodies, because they are inflammatory and they lead to chronic disease and cancer and all these things that we treat all of them with lots of medication while we could just be reverting visceral fat and getting better and better, right?
Mm-hmm. Yeah. And I think that's important. What you were saying there is that if you have a lot of this fat, it produces these cytokines, these inflammatory chemicals. So it's causing issues,
Yes.
which could become quite severe. So I'm going to go into the screen share now. So we're gonna look at Dr. Rosa, a before and after, or before versus now. If
Yes.
let's go into this. So again, anyone who's listening to this audio, I'm going to try my best to explain. There you
Yes.
go.
So the picture that I am way overweight, you can even see my face, like how the nose is wider, how
Mm-hmm.
the face is way redder, more red, right? All the inflammation signs from the visceral fat. And at that point, I was weighing almost 220 pounds. And I was going through a lot of stress. My husband was sick with cancer. He was, in fact, dying because he had stage 4 cancer. And food was my numbing medication, right, for my stress and everything else. So I got to weight 200 and almost 220 pounds. But like the major thing that we were talking about is you can see the facial characteristics that are the wider nose and the reddish, and when you look in the on the picture that I am less fat, and it's kind of recent, but not the most recent one, you can see that not only the face is leaner, but it's less red, and my nose is less wide as well. And this is a process, like it took me around 21 months to get from one to the other, and doing the strategies daily. And I tell myself repetition is key for your progress and for your health. There is a client from Dr. Omaran that says that you have to be tough to be healthy. And that's true. You have to choose your heart. So when you don't want to do something, just do it because it's for your benefit. And the strategies are very simple. And I don't know if you're going to talk about the strategies later, but they are very simple and starts with one major task, which is eliminating completely all processed foods, all foods that are processed or ultra processed. Just by doing that, you are already going to see a significant decrease in your inflammation, in your visceral fat. And then you start stacking habits. You add the not eating processed foods with eating more protein and more keto or more carnivore. And then you do fasting, and then you do sprinting, and then you can do your walking. I walk every day from always 10,000 steps or more. Take care of your sleep. You know, there are many things that you can do that are simple, that are free, and you just have to put your commitment and your consistency. And Dr. Sean O'Mara, he describes all of them. I would definitely invite you all to follow him and learn, because he is my mentor, my guide, my friend, and we worked together and we worked together. And you can do it. You know, you definitely can do it. We can do this together. I'm doing this myself, and I'm going to do this for life, you know, because it took me 50 something years to get very ill, very sick, and very inflamed. So it's going to take me some time to revert the inflammation, and you got to get it time. You have to give it time, because like I said, you have to heal your body from inside out. You have to decrease the inflammation, and then you decrease the visceral fat, and then you go at the same time building muscles. And yeah.
Well, I think that's good advice, because what I like what you just shared there was the timeline. So 21 months on this, on what we're looking at here, where, as you said, you know, a different Anna on the left versus on the right now.
Thank you.
And I mean, yeah, facial expression wise, you can definitely see the change in your facial structure massively on that one. But it's not an overnight thing. It's not a 30 days and you've melted all this fat away kind of game. It takes work. There's some progress that needs to be done on this one. So we'll go through a couple of these, and we'll jump in. We talked a little bit about this one here, and this is the timeline. So if you wouldn't mind just explaining to listeners, what we're looking at here is body mass index, or BMI, and a scan of different how do I explain this? It's
Different
like
people.
yeah, and but also what
At
we're
the
looking
same
at.
level in your abdomen.
Yeah,
This,
so we're slicing someone in half and just looking at a snapshot of one, like a few millimeters of someone, basically.
yeah. So again, we are trying to speak as simple as we can for any of us to be able to understand. I'm not using my doctor language, and Gary is not using the doctor language as well. We're going to speak as simple as everybody could understand, because I believe that's for each one of us to just take action. So all these people, we have 9 people here that were scanned with the MRI. All the abdomen, and the level there is at your belly button. Is so the BMI of all these people is the same, and it's a normal BMI of 24. I don't have the mouse, but Gary does. So if you start at the most normal one on the top, for me it's the top left.
Mm-hmm.
So if you start at the normal one and the top left, you can see that this person is metabolic healthy. This person doesn't have much, almost none visceral fat, which would be what you want, has a good bulk of muscles, and very deep, very little subcutaneous fat, particularly the deep subcutaneous fat. But when you start going from left top to the bottom right, you will see an increase of the white material inside of the abdomen. And all this white inside of your abdomen is fat in this sequence. And that is the visceral fat. So when you look at the top left to the bottom right, you can see that there is a significant difference in the white that you can see inside the abdomen. And that's like you go from metabolic healthy when you are skinny or thin or not overweight, with very little deep subcutaneous fat, with very little visceral fat. And you go to the bottom right when you have more deep subcutaneous fat, you have more visceral fat, and you are still believing that you are healthy, and you are not. You are the silent obese. You have this invisible enemy inside of you creating inflammation. You are metabolic unhealthy, and you are a person that is prone to have a cardiac attack or, a stroke or pre-diabetes or diabetes, and you are asking yourself, what is going on? I am normal weight, I look healthy, and you're not. And the MRI is what is going to tell you exactly what's going on inside your body. And like we talked about before, the visceral fat produces inflammatory substances, the cytokines. The visceral fat decreases your immune system activity, or not activity, decreases your immune system ability to detect bad things in your body, inflammation or cancer or old cells, because your immune system will be attacking the visceral fat instead of attacking what it's supposed to be looking at. So it increases your risk of having autoimmune diseases, increases your risk of cancer, and the visceral fat also produces substances that will increase your stress, increase your cortisol, increase your insulin with insulin resistance, increase the sugar in your blood. And this is a ripple effect, a snowball effect that is vicious in your body. So one feeds the other, and they keep feeding each other, and you just keep getting sicker and sicker.
And what I notice here too, just looking from between all the images, is, as you said, the fat, but muscle. And so the other key aspect here is that you're going from someone who's got a lot more muscle inside them to someone who has a lot less muscle inside them.
Yes.
So would you say the new Anna speaking to the old Anna, with your journey now too, it's not just about trying to lose fat alone, but it's also trying to build muscle? Is that like the two components to the success story here?
Absolutely. Absolutely. So when you are decreasing your visceral fat, you keep doing your muscle training, your strength training, your resistance training, or exercises that push you to your limit. And and walking and sprinting, and you're gonna build muscles together. And the more you lose your visceral fat, the more you increase the production of muscles, because then you're going to have myokines from your muscles that will stimulate the muscle production. And it's very important because it's strengthening your muscles, it's improving your balance, and it's strengthening your bones as well, your bone mass. And it has been proven already in many studies that muscle mass is also correlated with memory, with brain function. And muscle mass, when you are exercising, you are releasing something that it's the myokines are called substances, molecules of hope. So it has been proven that when you are exercising, walking, sprinting, building your muscles, you are improving your mood. So it improves mental issues like depression. And it has also been proven that by decreasing visceral fat and inflammation, you can improve like other mental health issues as well. Hence, like kids that suffer from epilepsy, they do diets that are very little in carbs and no processed foods, and they are able to control their episodes of epilepsy, right?
Mm-hmm. So,
and you could see, I'm sorry, you could see
yeah,
in my image the before and after
yeah.
that.
Let's go down to that's a good one over here.
Yes. Oh,
Yeah.
dear God. Yes. So the bottom one is me 21 months ago. So you can see lots of subcutaneous deep fat, and you can see all this white inside my abdomen is visceral fat. All this white is the fat that was killing me. My all my blood tests were abnormal. I was pre-diabetic. I was suffering a lot from asthma and eosinophilic asthma, eosinophilic esophagitis, and not sleeping well, and rosacea, and bouts of inflammatory bowel disease, which is inflammation in your bowel that could give you diarrhea. So and very depressed and very irritable. And you can see also the muscles in my abdominal wall, they are very thin, and there is lots of white streaks, which Sean calls as marbling, throughout the muscles. So the muscles were being replaced with fat because it's called sarcopenia. So as you age, myosteatosis, in fact, but sarcopenia is when we are aging, starting at age 30, we start declining our muscle mass. So if you don't take action, that's why you're going to be very frail when you are elderly, because you keep losing muscle mass, and it's exponential loss. The older you get, the faster you lose your muscle mass. So if you add to aging, if you add visceral fat and inflammation, that's a recipe for disaster. You're definitely going to lose your muscle. And you can see that in my abdominal musculature wall, and the muscles around my vertebral bodies. And you can see that they are very whitish replaced and very thin. So that's the bottom. And then I started my strategies, and I started taking care of myself with commitment, consistency, and doing my best. And then on the top, you can see that the inside abdomen fat has decreased, and it is still a moderate to severe amount still, but has decreased. And also, if you compare my muscles, particularly the oblique musculature in the abdomen, you can see that it's thicker, and you can see that is darker because I'm building muscle. And I'm telling you, I am in menopause. I am 54 years old. I am in menopause, and I am building muscles. So if you are younger, it's even going to be a faster process for you. But it's not about being fast. It's about being consistent, and it's about being done for your life, because you don't want to do it, get better, and then you just, oh, I'm fine now. No, you have to do it. You have to get better, and then you have to get better, and then you have to get better, because there is always room for improvement, right?
Mm-hmm. And thank you for sharing these personal images, because it is, as you said, once you see the images versus like a 44%, you see this stark difference where on the bottom it's just white. There's there's white on the outside, and there's so much white on the inside. I can see what you mean by advanced now with that word. That would be advanced, I guess. Would you say?
Yes, severe. Yeah. Yes.
Yeah, and then your
extreme.
God, if the radiologist put the word extreme on there, Jesus, I don't know.
I know, yeah.
But no, yeah, and then what I see that on your top image there, where what I do find interesting looking at your top image, which is your now, the after the 21 months after, is how the outside of your body, so say between your skin and your stomach, that hasn't changed too much from a thickness point of view. It's the inside part that's changed dramatically for you, as you said. And that what I'm seeing is that your muscle is so much darker on the top now, which is healthier because there's more muscle versus the white streaks on the inside, the marbling you were talking about.
Yes.
So, this is the point where hopefully people are like, okay, I understand what this visceral fat thing is. It sounds really like not a good thing to have. I need to start getting rid of it. If you had to look back now, Anna, and 21 months ago, and you were looking at the bottom person there, what kind of advice would you give yourself back then? What you've learned on? We'll start with nutrition-wise. Like, where would you have started, Anna, 21 months ago?
So before I talk about it, I just wanted to say something regarding the fat, the subcutaneous fat, the deep and superficial. So we were just talking about this last week, Sean and I. So that's why I'm going to bring this up. In general, when you are doing the strategies that he advocates and he has for his clients, and I am one of his clients, when you are doing his strategies, you are going to decrease visceral fat, and you are also going to decrease the deep subcutaneous fat. I am one of his clients, and he has a couple of other ones who have not decreased the deep subcutaneous fat as much as it usually happens. And our guess is because of stress. So I am still dealing with a lot of personal stress in my life. And these other people who haven't decreased deep subcutaneous fat as much as are also dealing with a significant amount of stress. And by stress, I mean stress, So we believe that the deep subcutaneous fat has not decreased as much as we would expect, considering the decrease in visceral fat that we see, because the stress, the cortisol, and is still high. And I could attest that because I also do some blood tests in myself, and I still have inflammatory markers that are elevated, and they are inflammatory markers that correlate with stress. So the more strategies you do that will decrease your stress, the faster you are going to lose the visceral fat and the deep subcutaneous fat as well. So that's just a heads up that I could be better if my stress was better, but some things you just can't control, right? Yes, you can improve, but you can't control. So I'm putting more effort in the strategies that are important for decreasing stress.
So,
So
sorry, Anna, I will touch on that point because I think that's super important. If you had to tell your old self something,
yes,
it would be that, hey, look, you're going to implement all these strategies, but what you've learned is how important stress is too. And if you don't get the stress management under control, you're still going to be dealing with, as you said, the deep subcutaneous fat situation as one
yes,
example.
which is inflammatory, very inflammatory as well. So I would say, and Sean advocates that, I would say that the strategies that work really good for my stress are sauna, my walking. I used to hate walking. And I started I was really the workaholic sitting radiologist that works like 12 hours a day. And you don't get out of your office and you're just looking at the screen. So go figure, right? Screen and sitting all day. So walking has become in the last 3 years. In the last 3 years, I started December 21, 2021. That's so interesting. And I can't forget because it's 12/21/21. And that's when I got my 10,000 steps for the first time in my life. And I have never skipped 10,000 steps again, almost like as an addiction that I'm counting the days for me not to start them again. So I have not cut my streak of walking 10,000 steps. Doesn't matter if it's 11 p.m. at night, doesn't matter if I am super tired, or even sick. I do my 10,000 steps as slow as I can, but I do. And in general, what I saw with me, my sister, and the people who are around me who started walking is you walk 1,000 steps every 10 minutes. So it's really easy to organize your day. So I would tell myself, Anna, stress is really damaging. Learn to do techniques that bring mindfulness, like the five senses technique, or vagus nerve technique to calm you down with breathing. My walking became my mental accountability partner. It's my time to just be with me. I'm talking on the phone, I'm walking. I'm checking my email, I'm walking. I'm reading my Bible, I'm walking around my house, or outside. It's super cold here in Nebraska. It's like 10 degrees Fahrenheit. And I walk inside my house. My basement is long enough for me to do my circles, and my dog probably thinks that I'm crazy, and I'm fine. So I do that. And sleep is very important. Each person has a pattern of sleep that should be respected. And I would say for me, it's 7 hours or more. If I sleep 8 or 9 hours a night, that's when my Aura ring tells me optimal. And I love this ring because of that. I'm not making any propaganda. I definitely was very skeptical about it when I got it, but it definitely helped me with sleep because, yeah, sleep is something that I work daily on it. Magnesium before going to bed helps me with my sleep too. So stress related, all kinds of exercise except running, because you don't want to do running because running. doesn't really help with visceral fat and doesn't really help much with your myosteatosis either. But like definitely like strength training, exercises that are high intensity interval training that push you to your limit, push ups, pull ups, and my walking, like I said, meditating, which I don't do very much, journaling, which I don't do very much, but I know that this can help a lot. It helped me during my grief journey as well, and just giving yourself grace, you know. Some days you're going to feel like, man, I really don't have the energy, and that's fine. Take your time to rest, do your steps, give yourself grace in increasing the steps and increasing the activities, little by little. Don't push yourself, otherwise you're going too much, otherwise you're going to end up giving up because you're going to feel overwhelmed. And these are the most important things about stress. And manage your day. Separate time for you. Schedule in your calendar. I'm taking 15 minutes to go do my walk. Because if you don't do that, as a workaholic person, you just do everything for your work and just do everything for everybody else, and you leave yourself for later, and later you have no energy. So you have to put yourself as priority number one.
Mm-hmm. And again, thank you for sharing, your personal insights here, because it adds realism. No one's perfect. We try and make ourselves better, but it's a journey. It's a step. And yeah, sometimes you get it right, sometimes not so right.
Yes.
And just touching on then, so we've talked more. I like that we've talked on the psychology part of things, because I do feel that's important. So it's sort of nutrition, exercise, and psychology. We've sort of touched on the psychology part. So nutrition wise, what did you have to change in your eating habits in order for you to improve your visceral fat? What did you do personally?
Yes. I eliminated all processed foods. All processed foods. And that's what I've learned with Dr. O'Mara as well. Processed foods are your enemy, and they really lead to increasing visceral fat like super fast in your body, and increase your insulin resistance, which is the enemy as well, the base, the foundation as well, and your blood sugar. So I eliminated all processed foods. I do fasting, and you could do fasting as long as you want, as you can, as you feel able to. Like if you start feeling weak, you should, interrupt your fasting. And I do take care of my hydration with electrolytes and good like quality of mineral salt that I put in my water. Good quality of water. Make sure that you are avoiding water that has chlorine. And yes, and I am eating basically carnivore. So I eat more meat and eggs, and I don't do well with dairy. I don't get milk. Milk, you should avoid milk as well, and Greek yogurt. But like dairy is something that I have the tendency to eat more. So I kind of try to avoid dairy. Sean talks about this all the time: fermented vegetables and fruits, fermented, because then you're going to be rebuilding your gut microbiome, which is so important to avoid like to improve from inflammation as well, the leaky gut problem. And so that's what I do. I try to eat before it gets darker. So usually I eat, my last meal is going to be 4 p.m. I usually have one larger meal and a smaller one during the day with an interval of around 2 hours. I keep my protein, and my creatine for my muscles. So I know that for my weight and my height, I'm supposed to have 100 to 150 grams of protein daily. So these are the things that you can do, And again, all these things are for free, right?
Mm-hmm. And I think also knowing your age and where you are hormonally, as you said, within menopause, it's nice again to hear that you don't have to start this journey only when you're in your 20s or your 30s and you're super fit and everything's right. You can start at any stage. So anyone listening to this right now, it's just taking step number one, which is the hard part. And exercise-wise, what did you change there? Because I know Dr. Amaro talks a lot about sprinting. So did you have to get your sprinting shoes on and start and out there in Nebraska go for a quick sprint or something? How did you actually practically do the sprinting?
Yes. So before I go there, I'm going to tell something that you said there. There is no age limit for you to begin. And I would definitely encourage you to begin, because now we are talking about longevity. Oh, I want to live longer. I want to live until I'm 90. I want to live until I'm 100. But what is the point of getting older if you are not functional, if you can't move, if you cannot take care of your body, if you cannot, stand up from your couch or play with your grandkids or travel and have fun, if you can't carry your grocery bags, if you can't remember who you are, right? Alzheimer is really called diabetes type 3 now because it's related to metabolic syndrome, visceral fat, insulin, and glucose. So I would definitely say, instead of thinking that you want to live longer, I would say, think about, I want to live longer and be able to enjoy while I'm living longer, right? So exercising, yes, Dr. Mara talks about sprinting. Sprinting is not one of my most favorite activities. I would say that many weeks I don't sprint at all, especially the running portion. I do have a bike here in my house, a stationary bike that I do sprintings on my bike. And there's a really nice book that talks about how you could sprint not only by the regular normal sprinting, but you can sprint on your bike, you can sprint on your treadmill, you can sprint on your elliptical. Of course, sprinting as the normal, the original way of sprinting is the best one. And I would say start slowly. You don't want to hurt yourself. Start on an uphill, like he says, get the speed, and then you'd go. Um, the weeks I am doing better with sprinting, I usually do 3 or 4 of 15, 20 seconds. I think I do 20 seconds because I count in my brain. It's 20 seconds, and then I walk and walk and walk and walk until I calm down, and then I do it again, and I do like 3 or 4. But sprinting is definitely something I need to work more on it. I like better my walking, and I do my strength training 3 to 4 times a week. And that's something that I really love it. And I do it with, it's called eGym. So the machine kind of calculates my weight, and I am reevaluated every 6 weeks. And I am so happy because now the machine is telling me that I'm 42 years old. So I'm like, woohoo, I started at 78. I started at 68 or 72, something like that. So yeah, so it's really good to see your improvement. And that's one thing that is so important in building a different life. It's celebrating just by doing 1 minute of a plank, celebrating, because it's research proven too that it's a circle, it's a closed loop. You have to close the loop. You have to take action, which is called behavior activation energy. When you don't want to do something, you take the action and you do it, and then you're going to start feeling better. You're going to build the energy. You're not going to wait for the energy. You're going to build the energy. And then you do it. And then you start getting better. And for every step, doesn't matter if you feel it's a small step, just like, oh man, I just got out of my bed. It does not matter. Celebrate yourself, because that's when your brain gets the reward system, the dopamine, the dopamine rush. I don't know. Yeah, spike. And that's when your brain links that behavior as something that it's pleasurable, because human beings want to do things that are pleasurable. So you have to celebrate yourself, because that's how your brain is going to see you as reliable, and that your brain can trust you, and you're doing that for yourself, and you get your back, and your best friend, and your best accountability partner.
Love that advice. So I think hopefully we've inspired a lot of people, and they may want to do that next step now. So what do they ask their provider, which is their doctor, their physician, who would be able to order this MRI or a CT scan? Like, what, if I was wanted to now know what's going on in my body, I'm listening, anywhere in the world. What would your recommendation be to someone to go ask their provider to take a step forward on this one?
I would say talk to your provider about visceral fat and insulin resistance, especially if you are pre-diabetic or diabetic. Talk to your doctor about inflammation and chronic diseases, and talk to your doctor how you would like to have an MRI of your upper abdomen without intravenous contrast. You know, the MRI would be really good to see the visceral fat. The MRI could see fat in your liver, fat in your pancreas, fat in your muscles. So, all these things could be useful for your doctor too, because if you have elevated liver function tests, if you have high blood sugar, if you have abnormal lipid tests like HDL triglycerides, so then your MRI could definitely be beneficial for you as well.
Okay, perfect. And hopefully that helps guide someone, because as you said, not many radiologists are reporting on visceral fat levels here. So this may come as a surprise for some people, going like, so what is it you're
Yes.
asking for? Yeah.
Yes. No, probably it's going to be, most likely it's going to be a surprise. Most likely the radiologist might not report that. But again, come to me in my Instagram page. I'm teaching you how to read your MRI. Come to Dr. Omara. He even has appointments that he evaluates the MRI with you, and just appointments just for that. So it's definitely worthy, your help. You, like he says, you are your major asset, you are your major investment. It's your health, it's your life, and you gotta take care of it. You gotta be the owner of your destiny, and your actions define your destiny. Look at me, the MRI again, like 21 months ago. I was pre-diabetic. I was with no muscles, sedentary, workaholic. And my life changed because I made the decision. I made the choice that I wanted, or more than that, that I needed to change. And my why, which is very important to you to connect with your why, was not because I wanted to be skinny or I wanted to be cute or I wanted to be elegant. They are in the why too. But my major why was I want to age healthy. I want to age with a functional body, with movement. I want to be able to, if I fall, don't hurt myself too much. If I fall, get out of the floor by myself, you know. Um, and that's so very important. I told myself my grandma was diabetic. I told myself I'm not gonna become diabetic from pre-diabetes to diabetes because it's in my power. And if you are diabetic, stand in your power, because you can get better or even reverse your diabetes just by doing what I am doing daily.
Well, Anna, I just want to say again, thank you so much for sharing this knowledge today. I've learned more about visceral fat myself. It's a topic I'm very interested in personally. Um, I think it's because, especially now, we're talking in January of the new year, everyone's trying to do a weight loss program, but is not just the outside weight or the weight on the scale here. We're talking about long-term health, and aging health, which is the inside fat, and making sure that the health around your organs is good too with this one. So I think using images, I mean, your before and after are night and day. It's so obvious.
Thank
So
you.
that's so educational. And if anyone wants to follow you, what is your Instagram? Just mention it to people, because I think you've got Instagram and Facebook where you post, right?
Yes, I am posting more on my Instagram, and then it goes to my Facebook. So on Instagram, I am Ana Rosa Gratitude. And on Facebook, I am Ana Claudia Rosa. And again, do it for yourself. Say yes to you, say yes to your life. And it's a decision. And don't do it because of others. And don't do it because of a New Year's resolution. Do it for your life resolution. Do it for the higher version of you resolution. Like, again, I started walking in 2021, and my first streak of 10,000 steps was December 21. So I started in December. So that's for you to know that you could start now. Well, in fact, I'm going to say it differently. If you are here listening to this podcast, it's because something inside of you resonates with the need for you to take action and ownership of your life. So you have already started. Your first step was watching this podcast. I am proud of you. I honor you. I congratulate you. Hug yourself for me. And that was your first step. Plan the second one. I'm here with you. We are here with you. You did the first step already. Don't shy from the second.
I love the energy, Anna. It's perfect. Yeah, it's what people need. It's why I do what I do with this. It's inspiration and motivational. And you are both of those. So thank you for what you've done.
Thank you so much for you.
All right. Okay. Take care.